Hundreds of thousands of Victorians will have just 2 weeks to get at least one dose of a COVID vaccine if they want to keep working on site after the state government dramatically escalated mandatory vaccinations to all authorised workers. It's bound to ramp up the vaccination rates. Victoria has surpassed 80% first dose after more than 94,000 jabs yesterday. More than half of all Victorians 16 and over are also fully vaccinated. In an effort to avoid overwhelming the hospital system before we reach vaccination targets, the government has mandated vaccination for all on-site authorised workers from October the 15th. But the case numbers continue to put strain on the health system. It was our second day of over 1,000 cases, and sadly there were 3 more deaths. State political reporter Bridget Rollison begins our coverage.
It's a choice around 300,000 Victorians will now have to make. Get the jab or lose their job.
It is not a decision made lightly, but it is all about protecting the roadmap to reopening.
The massive shift in policy comes after cases rocketed past 1,000 over the past 2 days, and there are fears it may soon become uncontrollable.
It's probably fair to say that many people would have been quite concerned, scared even, to see a number as high as that.
Well, today we've seen the Premier panic.
All authorised workers, from personal trainers to police, supermarket workers, journalists, members of parliament, elite athletes, food delivery drivers and farmers will need to have their first dose by October 15.
If some workers and farmers decide that they don't want to be vaccinated, is that just going to exacerbate the worker shortages that we already have in our industry?
This will help us propel much faster to that 70 and then 80% double vaccination levels.
Today, small protests were held across Melbourne, including from teachers who rallied against the mandates for their industry.
We don't feel like we've got choice in this situation.
As the vaccination push continues, so too does the push to try and contain the spread. Moorabool Shire, to the west of Melbourne, is being sent into a 7-day lockdown from midnight after another 6 cases today.
Moorabool shares a border with some of Melbourne's worst affected areas.
Some of those cases are flowing to GP clinics, leading doctors to demand urgent changes to isolation rules from exposure sites. This clinic in Spotswood was shut down and deep cleaned 9 days after a positive case was there. Several workers were sent into 14 days isolation despite being in full PPE.
We're just going to end up with an unsustainable service in many general practices.
Similar calls are coming from supermarkets after some stores were forced to temporarily close because of staff shortages. The big chains are pleading with the government to follow New South Wales and ease isolation rules for fully vaccinated workers.
Over the next coming months, there could be some workforce impacts that are going to result in some reductions in production of food and grocery products.
The Premier's flagged changes to the isolation rules, not only for essential services, but also Victorians returning from interstate. Bridget Rollison, ABC News, Melbourne.
And in news just to hand, the city of Greater Shepparton is heading back into a 7-day lockdown from midnight tonight. Case numbers there have been increasing, rising today to 24. Residents will be subject to the same restrictions as Melbourne, excluding the curfew. Meanwhile, construction sites in Victoria can reopen in 4 days' time after the government and industry thrashed out a new set of rules. Mandatory vaccination remains, but the closure of crib rooms will be reversed if there is proper ventilation. The reopening plan has been applauded by employers and the unions. Here's state political reporter Richard Willingham.
For some workers, the only tough vaccine choice is which arm.
You want that one? And you told them down there that...
Yes. Industry is taking shots to workers and the vast majority are willing.
We've got to get the rates up. We've got to see if we can get rid of this disease.
The sector does face some loud resistance to mandatory jabs and COVID rules. But the government isn't budging.
We want to see a new approach, a reset and a restart.
From Tuesday, construction sites can return at 25% capacity if all workers have had one shot. If all workers on larger sites have been double dosed, it can operate at 50% and crib rooms can open if...
Issues of enhanced cleaning, density requirements within the crib facility, and also the installation of additional ventilation to move the air through the crib rooms.
Businesses are ready to support their workers, they're ready to work within the government's compliance framework, and it's a condition of our reopening.
Unions are also supportive.
A group of morons may have managed to shut down construction, but the members of the building unions are the ones who got it open safely.
Next week, smaller builders like Top Constructions will be able to operate with 5 workers on site. It will mean slower work.
We consider ourselves really fortunate to be able to have worked throughout most of the pandemic. When a lot of other industries have been doing it really tough. So whilst, it's not ideal and it's a bit inconvenient, we're just happy to get back into it.
Getting construction back on the tools is important for the government, workers and the economy. It'll be up to employers to check the vaccination status of workers and to keep records. Authorised officers will be conducting audits and there'll be fines of tens of thousands of dollars for those that don't comply.
There is a zero tolerance approach to non-compliance.
Our industry is very heavily regulated and we're very used to abiding by these regulations.
As workers pick up their tools on Tuesday, students will pick up their pens for the GAT. Teens in 22 high-risk postcodes across Melbourne have been told to get a COVID test ahead of the exam. Richard Willingham, ABC News, Melbourne.
GP clinics have had to cancel hundreds of vaccination appointments along the New South Wales-Victoria border after the government broke its promise to deliver thousands of additional Pfizer vaccines. Another clinic in Melbourne's east has also revealed it injected patients with a saline solution instead of a COVID vaccine. Michaela Ortolin reports.
Just days before the expected delivery of thousands of Pfizer doses last week, more than 10 northeast clinics were told they weren't coming.
Why would the state government say, hey, we have all this vaccine available, can you get it out to every GP clinic quickly? And then in the next instance say, oh, sorry, that vaccine didn't exist.
Indigo Family Medical Centre in Barnawartha was forced to cancel hundreds of bookings, leaving many vulnerable residents at risk.
We have a lot of Aboriginal people here, we have a lot of people in the NDIS and elderly people who don't have necessarily the transport to drive 30 minutes into Wodonga.
Sarkon Medical Centre near Albury also closed its doors after a promised 4,200 Pfizer doses never arrived.
Disappointing because the Department of Health was not able to keep up their promise of delivering such a big number of vaccine.
The Department of Health responded with a statement saying it's aware of the issue and that a task force is working with the primary health networks to identify any excess doses that can be rediverted to the clinics. But no explanation has been given as to what happened to the promised doses.
I'm hoping it was probably just a glitch in the system, maybe a miscommunication.
Meanwhile, a general practice in Melbourne's east has apologised to patients who booked in to receive a Pfizer vaccination last Sunday. Deep Dean Surgery has admitted 30 people may have mistakenly received a harmless saline injection instead of the vaccine. The surgery says it's reviewing its processes to avoid the bungle happening again. Michaela Ortolin, ABC News.